chances are huge that they're going to get somebody who's not really acting in their best interest.
It sounds as though you have very little trust in kind of the rank and file financial kind of systems that are in place for most Americans. Is that accurate?
Absolutely. I mean, you would be surprised the egregious, absolutely horrendous things I've seen from prospective clients I've met who are all physicians. And the stuff that their previous advisors, and when they've come to me, I look at some of this stuff and I say, gosh, this is just, if we were physicians doing this to patients, we'd be in jail.
And what would examples of that be?
Here's a great example, and this is an example that I see just routinely over and over and over again. So you have a physician who, for example, has an advisor, and I kind of look at their portfolio, for example, just kind of focusing on the investments for now, is there's all these kind of mishmash of different funds here and there. And one of the things that I asked prospective clients and even my current clients is, hey, look, what fee are you paying to your advisor? And the number one response I get is, I don't know. And to me, that's a big red flag right there. If you don't know what fee you're paying to your advisor and he hasn't told you, there's something wrong. And, to me, not disclosing fees up front is one of the biggest things that really sort of makes me mad, because then you really don't know whether the advisor is really acting in your best interest or not.
And so if you're a physician, what are the questions they should be asking if they're interviewing a financial advisor?
Yeah, that's a good question. The first and probably most important question is, how are you paid? The most common fee structure is commission-based by far. Advisors are paid by the transactions they make and the products they sell. So, for example, you could have insurance agents that mask as financial planners who basically sell you initially insurance products and then go around and sell you mutual funds in your investment accounts purely for the commission and the kickback that they get, but they don't actually disclose the fee. So the first thing you want to ask is, how are you compensated? If it's commission-based, you've got to have your antenna up, because then you know that, hey, look, if this person is going to advise me, how can they possibly advise me in an objective manner? They're just trying to sell me products. The second is what's called fee-based, which is not the same thing as fee-only. Fee-based is kind of a combination of charging commissions and fees directly. But again, there's an inherent conflict of interest there because they're still partly commission-based. And then there's fee-only, which is kind of like a CPA that basically says, okay, I'm a financial planner and I'm going to charge you this dollar amount fee. I'm not going to get paid by any third party, and these are the services you get from me. That's it, clean cut. So the first thing you want to ask is, what are the fees that you're paying? Second thing is, what kind of education and training do you have? You'll be shocked at this, but there's really no formal education or training required to become an investment advisor. You basically go up to your state's securities department, they fingerprint you, you sign an application, you take this short test about some basic legal stuff, and wham, in about 2 months you can call yourself an investment advisor. So what you want to look for is kind of a bit more of a formal pathway, and the best I know of is the Certified Financial Planner curriculum and program, which really kind of focuses on not only investment planning, but kind of integrating that with retirement planning, estate planning, insurance planning, education planning, and those other things.
Are there any financial planners who are paid based on performance?
Depends on what you mean by performance. There's two ways to define it. If you strictly define it as you'll be paid by a percentage of the gains, the answer is yes. There are some that are out there, but those, for example, for me as an independent, I can't do that. I'm not allowed to get paid by specifically charging fees based upon performance. The common ways to do it are, at least on the investment side, a percentage of assets under management, or flat or hourly fees is another model that you can do. So I guess technically a percentage of assets could be technically performance fees, but the way that the SEC, which is my regulatory body, defines it is a percentage of the gains that are made, and I'm not actually allowed to do that. Now, there might be other people that do that. Hedge fund managers, for example, do that, and they're not really regulated by the SEC at this point.
What are the physicians who are more successful with their financial planning? What do they have in common?
Well, first of all, I think it's a very small group. Most of the people I've met, sure, they might make high income, at least according to the IRS, but having high income and being financially successful, I think, are two separate issues. So if you're spending all the money that you're making, you're probably not going to accumulate enough assets where you can call yourself financially successful. But the common traits that I see are, one, having a kind of a comprehensive plan in place. The second kind of thing that I've noticed is people who basically say, I've realized that I can't pick the winning stocks, I can't time the stock market, I can't pick the winning money managers. The best I can do, and what all the academic research says I should do, is match the market. And the third, of course, is staying disciplined enough to stay with the good times and bad, as well as kind of taking the approach of, okay, I really don't know what the future holds. It's completely uncertain. I don't know what my income is going to be. I don't know if I'm going to become disabled. So, I'm going to leverage, time on my side, and of course, increasing my savings to make sure that I have enough to retire on. So it all sounds kind of basic, but you'd be surprised that most physicians don't do those things.
So you brought up another interesting point, which is matching the market. Why would I need a financial advisor? And why wouldn't I just, invest the money that I'm going to put in the market, whatever percentage that is going to be, and have it, match the S&P 500 or invest in a matching fund?
Yeah, that's a good question. Well, I think if you look at all the data that's done on this issue, exactly answering this question is, okay, here's a great study. This comes out about once a year, maybe once every 2 years. It's called the Dalbar study. And here's what it basically says. It says, okay, you take the past 20 years, and if you're just stuck with the market, and this includes 2009 and 2008 and all the kind of the bad things that have happened in the past decade. If you take the past 20 years, you just basically stuck with everything, you still would have had a pretty decent rate of return, around 8% a year. It turns out the average individual investor, their return over the past 20 years, and this is the way this is calculated is based upon mutual fund cash flows across tens of thousands of different accounts and different custodians. The average individual investor got a rate of return under 2% a year. The market returned about 8% a year. The average individual investor got a rate of return about 1.88% a year. Turns out inflation was about 3% a year. So basically, what the conclusion there is that investors, when they do it themselves, are getting in and out of the market at exactly the wrong time. They're essentially buying high and selling low. And so one of the values of an advisor is basically discipline. And people tell me, well, gosh, do I really want to pay for discipline? And my answer is that's actually the number one thing you should be paying for, because your own worst enemy is usually yourself. And all the data show that. But then there's all these other issues like, investments is one thing, but how do you integrate that with, estate planning, or, how do you know if you have enough life insurance, or how do you know if you're saving enough? How do you know, this, that, or the other? And it's kind of like medicine is too vast of a field for somebody to kind of sit down if they have an inclination to do so and really figure it out.
What if you are inherently, not risk adverse? How do you kind of handle clients but are attempting to do things like start new businesses and grow their way into financial success?
Well, kind of the way I think of it is, like, for example, if one of the goals of a physician is to say let's say they don't want to work full time doing clinical stuff and they want to open up some other business, the real question is, how do you get there? How do you go from doing full clinical stuff to, say, opening a new business or whatever it is that your goal is? I think one of the key things that people have to consider is getting their financial house in order before you make that jump, because like any other business, even, for example, for me personally, making a jump from